The Prolaris test is a test that removes genetic material from prostate cancer cells and tells us about the aggressiveness of that prostate cancer. So the genes in Prolaris are cell cycle progression genes, also referred to as CCP genes or proliferation genes. They are expressed in higher levels in cells that are actively dividing. So if there's a higher level of expression of these CCP genes, that means that the cancer is more aggressive and is dividing more rapidly. So what we found is two men prior to Prolaris may look very similar. For example, they may have the same PSA, Gleason score, number of cores positive, but when they get the Prolaris result, they may have a very different mortality risk. For example, one man may have a 1 or 2% chance of dying from prostate cancer, while the other man has about a 12% chance of dying from prostate cancer if they have very different Prolaris scores. So Prolaris, unlike Gleason, tells you about what's going to happen in the future. So Gleason score will tell you how far the cells have gotten so far and what it looks like today. And the Prolaris score tells you what's likely to happen in the future. And what we found is about half of the time, a patient's mortality risk will be consistent with what they already knew from their Gleason, PSA, and other clinical and pathologic features. However, about the other half are equally divided between more or less aggressive. So about 25% of men have found that they have a more aggressive cancer on a molecular level, and about 25% have found that they have a much less aggressive cancer. So these patients have had the benefit of making more informed management decisions.